whether people seek truth or what they really seek is the reaction to hydroxychloroquine. The president mentioned it a couple of weeks ago. He probably has saved more lives than just by mentioning that than any Democrat in the House or Senate will in the course of their lifetime. Or for that matter, perhaps any Republican in the House and Senate. But the Republicans have not attacked him as the Democrats have. Because even when he does good, they loathe him. I never used the Trump derangement syndrome phrase, never. I now have no other explanation for the most overwhelming and irrational hatred that I have seen in America by vast numbers of people. To read the columns in the New York Times, as I do every day, and the New York Times commenters. Do you know how many people? I'll bet you don't even know this, Mr. Producer. I would say at least 25% of the 1,000 or so comments on the Frank Bruni, who's an opinion writer for the New York Times, piece on hydroxychloroquine, or whatever piece was on hydroxychloroquine on the New York Times, said that the reason that President Trump mentioned this was financial. I think it's produced by Novartis.
It's a generic drug.
I know it's generic now, but all right, fine. Whatever their theory is.
There's no money in this.
Okay, well, they believe that there is a money reason for his saying it. Mika Brzezinski said that? Yeah. Right. Meanwhile, I don't believe that any of these people would not give it to a loved one who had the disease. That's what you have to ask people, as I asked the doctor who called in last hour about 4 times. And I don't believe he answered my question, but that is the question. Would you use it? Everything else is academic. Dr. Oz was just on Fox talking about the anecdotal evidence that these patients already on hydroxychloroquine for lupus and other conditions rarely get the virus. Wouldn't that be worth finding out? And that shouldn't be all that difficult. Contact 1,000 people with lupus, and is their rate of infection the same as the general public? Especially people with lupus in New York City. That would really be dramatic. Oh, they've been on hydroxychloroquine and the Z-Pak. Apparently with zinc is the way to do it, because zinc attacks the virus, and this opens the gateway to attacking the virus. I know nothing about science. I'm merely parroting what I read. I know nothing about the science of virus. I can't say I know nothing about science. But this is the giveaway that they hate Trump more than they love American lives. The attack on hydroxychloroquine, which is universal on the left, to the best of my knowledge, and on the right, it seems universal support. Not because the president said it, but because it's true. Here, New York Times, just 3 days ago. Ignoring expert opinion. Expert opinion. That's the god of our time. I believe in science. I do not believe in scientists. They believe in science and scientists. Scientists are as honorable as third basemen. There's no rap on third baseman. Just to say there is zero difference between scientists, decency, honesty, integrity, and wisdom as baseball players or taxi drivers or lawyers? You think all lawyers are honorable? I'll bet you don't. Why do you think all scientists are honorable? Because you have been taught by people who see them as the priesthood of the religion of science. This is the New York Times. This is not even an editorial. There's no difference between a New York Times news piece or an editorial in any event. The president's advocacy of the anti-malarial drug has created tensions in his administration and fears among doctors that it could unnecessarily expose patients to risks. President Trump doubled down Sunday on his push for the use of an anti-malarial drug against the coronavirus, issuing medical advice that goes well beyond scant evidence. Scant evidence. That we live in different worlds of the drug's effectiveness, as well as the advice of doctors and public health experts. If that's what doctors and public health experts are advising, based on what I have read, I have no respect for those doctors and public health experts. Okay? A doctor who listens to the show in Texas, as I spoke to yesterday, he's a 100% believer in hydroxychloroquine for COVID-19. Mr. Trump's recommendation of hydroxychloroquine for the second day in a row at a White House briefing was a striking example of his brazen willingness. By the way, this is a news item.
Yeah.
This is the way they write news. Brazen willingness.
Yeah.
It's not an opinion piece. The New York Times has become a farce. Striking example of the brazen willingness to distort and outright defy expert opinion and scientific evidence when it does not suit his agenda. Yes, his agenda is saving lives. What is his agenda? Wouldn't you like to ask the authors of this piece? What is his agenda? Now, the average reader of the New York Times is just nodding along because they're a New York Times believer. It's the herd. But I'd like to know. That doesn't make any sense, the sentence. What is his agenda? They don't say.
In this news piece.
In this news piece. That's right. In this news piece, right. If it does work, it would be a shame we did not do it early, Mr. Trump said, noting again that the federal government had purchased and stockpiled 29 million pills of the drug. We are sending them to various labs, our military, we're sending them to the hospitals. What do you have to lose, Mr. Trump asked for the second day in a row, saying that terminally ill patients should be willing to try any treatment that has shown some promise. Is there anyone listening? Just ask this to your Trump-hating relative. Would you, if you were dying or very seriously ill with this, would you take it? Would you want your wife or husband to take it? If you wanted them to live. I mean, we're making that assumption. Dr. Megan Ranney, an emergency physician at Brown University in Rhode Island, said in an interview Sunday night she had never seen an elected official advertise a miracle cure the way Mr. Trump has. There are side effects to hydroxychloroquine, Dr. Ranney said. It causes psychiatric symptoms, cardiac problems, and a host of other bad side effects. Would you take it, Dr. Ranney? Nobody ever asked that question. But Mr. Trump on Sunday, I'll tell you, the hatred of, it may well be, there are people who so hate Donald Trump that if a loved one were seriously ill with COVID-19, they would not give them hydroxychloroquine, and they would die, and they would think they did the right thing because they didn't listen, they didn't give any credence to Donald Trump. But Mr. Trump on Sunday dismissed the notion that doctors should wait for further study. We don't have time to go and say, gee, let's take a couple of years and test it out. Sounds reasonable to me. Thank God we don't have doctors making policy. Thank God.